Case conceptualization with a relational lens. Case conceptualization from a relational lens represents a profound shift in therapeutic practice, moving from a solitary focus on individual pathology toward a dynamic interplay of interpersonal relationships and systemic interactions. This approach acknowledges that human beings are inherently relational creatures, whose psychological realities are intricately woven with the fabric of their social environments. As therapists, adopting a relational lens necessitates a comprehensive awareness of the reciprocal influences between clients and their relational contexts, necessitating a sophisticated understanding of the theoretical and practical underpinnings of relational dynamics. Relational case conceptualization is grounded in the recognition that psychological symptoms often manifest not in isolation, but as part of broader relational patterns. This perspective aligns with the relational-cultural theory, which posits that growth-fostering relationships are central to psychological well-being. Instead of viewing symptoms as mere indicators of individual dysfunction, a relational approach interprets them as expressions of relational disconnection or dysfunction. This interpretation requires therapists to meticulously explore clients' relational histories, current relationship dynamics, and the socio-cultural contexts that shape these interactions. In practice, relational case conceptualization involves a nuanced exploration of the client's relational matrices. Therapists must engage in a collaborative inquiry with clients to uncover the relational stories that underlie presenting issues. This involves an openness to the multiple voices and perspectives that constitute a client's relational world. Such an approach is not limited to the interpersonal, but extends to the intrapersonal, considering how internalized relational templates influence self-perception and behavior. The process is dialogical, with therapists and clients co-constructing an understanding of how relational dynamics contribute to psychological distress and resilience. A critical component of this approach is the therapist's reflexivity. Therapists must remain attuned to their own relational positions and biases, recognizing how these may impact the therapeutic relationship. The therapeutic encounter itself becomes a microcosm of broader relational patterns, providing a fertile ground for exploring and transforming dysfunctional dynamics. This requires therapists to maintain an authentic presence, fostering a therapeutic alliance characterized by mutual respect, empathy, and genuine engagement. Relational case conceptualization does not occur in a vacuum, but interacts with various theoretical frameworks. Attachment theory, for example, provides valuable insights into how early caregiving relationships shape internal working models of self and others, influencing relational patterns throughout life. By integrating attachment theory, therapists can better understand the origins of clients' relational difficulties and devise strategies to promote secure attachment experiences within and beyond therapy. Similarly, systems theory offers a broader lens, emphasizing the interconnectedness of individual and systemic processes. Clients are viewed as part of larger relational networks that include families, communities, and cultural systems. This perspective encourages therapists to consider how systemic factors, such as power dynamics, cultural narratives, and social structures, influence relational experiences. By adopting a systems approach, therapists can address not only the intrapsychic, but also the systemic contributors to psychological distress. While relational case conceptualization offers a compelling framework, it is not without critique. Some argue that it may overlook the role of individual agency and personal responsibility in shaping relational outcomes. Others contend that the emphasis on relational processes may obscure the biological and neurological factors that contribute to psychological symptoms. These critiques highlight the importance of a balanced approach that integrates relational insights with other dimensions of human experience. To illustrate the practical application of relational case conceptualization, we can consider two in-depth case studies. The first involves a middle-aged woman, Jane, who presents with chronic anxiety and relational difficulties. Through a relational lens, her anxiety is understood not merely as an individual disorder, but as a manifestation of long-standing relational patterns rooted in her family of origin. Early experiences of emotional neglect and inconsistent caregiving have led Jane to develop hyper-vigilant attachment strategies, impacting her current relationships. By exploring these patterns within therapy, Jane begins to recognize her role in perpetuating relational dynamics and learns to engage in more adaptive interactions, fostering a sense of relational security. Pause. The second case study involves a young man, Alex, who struggles with depression and feelings of isolation. A relational conceptualization reveals that Alex's depression is intricately linked to his experiences of marginalization and cultural disconnection. As a member of a minority group, Alex has encountered systemic discrimination and cultural alienation, contributing to his sense of disconnection. By addressing these broader socio-cultural factors within therapy, Alex is empowered to understand his depression not as a personal failing, but as a response to relational and systemic injustices. This understanding allows Alex to reframe his narrative, fostering resilience and facilitating engagement in meaningful relationships. Pause. Emerging frameworks in the field, such as narrative therapy, further enrich relational case conceptualization by emphasizing the co-construction of meaning within relational contexts. Narrative approaches encourage clients to re-author their relational stories, challenging oppressive narratives and fostering empowerment. By integrating narrative techniques, therapists can support clients in reshaping their relational identities, promoting healing and transformation. Pause. Interdisciplinary considerations also play a crucial role in relational case conceptualization. Insights from fields such as anthropology, sociology, and neuroscience offer valuable perspectives on how cultural narratives, social structures, and biological processes interact with relational dynamics. This interdisciplinary approach enhances therapists' understanding of the multiple factors that influence relational experiences, informing more comprehensive and culturally sensitive interventions. In sum, relational case conceptualization represents a sophisticated and dynamic approach to understanding psychological distress through the lens of relational dynamics. By integrating insights from diverse theoretical frameworks and interdisciplinary fields, therapists can develop nuanced and effective interventions that address the complex interplay between individual, relational, and systemic factors. Through this approach, therapy becomes a collaborative and transformative process, empowering clients to engage in more adaptive and growth-fostering relationships.